Okay, so next, let's move on to another type of imaging modality called ultrasound. So first, let me ask you guys a question. So what sound frequency a human ear can detect? What range, right? This, sound frequency can human ear can detect?
About 20 to 20,000 hertz.
Right. So yeah, so that's the range, 20 to 20 kilohertz. That's the frequency range a human ear can detect. So ultrasound is defined as any sound wave above 20 kilohertz. Okay. So I don't think, ultrasound is going to be, unfamiliar with anyone, right? So we all heard, bats, right, can using this ultrasound to do the echolocation. And since this kind of discovery, then this has been, ultrasound has been used a lot, especially for submarine navigation throughout the early 20th century, and actually came to medical domain, into medical use in quite late time, like 1950s. And there's this is kind of like the ultrasound imaging technology, how this kind of evolved, right? So in 1942, Karl Dusek, right, the neurologist, which is the first physician to using ultrasound for medical diagnosis. And later, George was described the use of ultrasound to diagnose gallstone. And in 1958, right, Ian Donald was the pioneer in OB/GYN, right, using the ultrasound. So here's the principles of ultrasound imaging, right? So the ultrasound wave are actually produced by a transducer. So this is kind of like an image, what the ultrasound transducer will look like. So in this transducer, actually there's a piezoelectrical crystal, right? So it will corresponding to different electrical impulse, right? So it will change the shape corresponding to different electrical impulse. So this kind of vibration, cause vibration, will generate this ultrasound wave, right? So these ultrasound wave emitted from this transducer will transmit or to the body, right? So, and the sound wave will reflect back to the transducer by boundaries between tissues in the path of the beam. And when these echoes, right, hit the transducer, they also generate electrical signals. They are sent to the ultrasound scanner, right, to generate the image. So based on the speed of the sound at the time of each echo return, so the scanner will calculate the distance from the transducer to the tissue boundary. And these distance can be used to generate this kind of two-dimensional image of tissue and organs, right? And so basically, if some of the tissues right, so it's going to reflect these ultrasound, right? For example, the bones and the hairs, and it will appear as very bright on the ultrasound image. And if the ultrasound can pass through like the fluid, right, then in this case, it will appear dark on the ultrasound image. So anything between like the soft tissue, muscles, and fat will show, different shades of gray. And in terms of the features of ultrasound imaging, so usually it has low resolution, right? It has very low signal noise ratios in deep regions. And it also has ability to imaging soft tissues. It's actually able to imaging soft tissues very well. And is able to do the imaging in real time, right? So if you're doing some ultrasound imaging, so the doctors or physicians, they moving the transducer, right, around of your body, you will see you have a real-time image show up on the computer, right? Different regions. So there's a couple of clinical uses of the ultrasound imaging, right? A fetal ultrasound or sonogram is an imaging technique that use sound wave to produce images of fetus in the uterus, right? So these are commonly used in OBGYN, right? So we have these sonogram. So it's able to, before even the baby is born, right? You're able to, using this ultrasound to identify the sex of the baby, right? Is a boy or girl, right? And also how the baby developed, right? So the size of the brain, the height, the weight, etc. And we can also using ultrasound image, right, to do some of the physical links measurement, right, the bone fat for the unborn babies, right. So like I mentioned, right, like the size of the head, right. So if the baby is kind of develop normal accordingly. We can also using ultrasound image, right, for renal artery, right? So this renal artery ultrasound is a test to check for problems in the renal arteries, right? The black vessels that supplies your kidneys. And this will provide detailed pictures of these blood vessels to determine the extent and the cause of restricted blood flow, maybe caused by renal artery narrowing, okay? So here is a study that was conducted at the University of Michigan, right? So the researchers are actually using the ultrasound trying to dissolve some of the clot in the blood vessel, right? So on the left of this ultrasound image, right, you can see this is the vein, right? So there's some clot in this vein. So you only have a very narrowing blood flow right through here. So they were able to develop this technique using this kind of high intensity ultrasound to kind of dissolve this clot in the vein. So after the treatment, you can see that so the blood flow becomes normal, right? So the blood is able to flow through freely. So it, kind of similarly, so I think for the some of the treatment for the kidney stone, right? So maybe the doctors will also recommend using ultrasound, some of the high intensity ultrasound to kind of shock the kidney stone, maybe break it into small pieces, right? So then this can be passed out through the body. So this may also application scenario of using ultrasound. Okay. So there's many benefits of ultrasound imaging, right? So most ultrasound scanning is non-invasive, right? So that means there's no needles or injections. And ultrasound is widely available, easy to use, and less expensive than most other imaging methods. So ultrasound is very cheap and very easy to use, right? Don't require very complicated setup, right? So easily just go into the room and the doctor will take the machine and do a very quick scanning and get those real-time imaging. So it's very easy to use. Okay. And even nowadays, there are new product for ultrasound imaging, right? Can have those mobile ultrasound imaging device, right? You don't have to go to a specific examining room, right? So those can be mobilized, right? Can push like a small table or even miniaturized ultrasound imaging you can carry out like a cell phone or mobile phone. So I think these are very convenient to use. And ultrasound imaging is extremely safe and does not use radiation, right? Because it uses sound waves. And it will also give a clear picture of soft tissues that do not show up well on X-ray images. And ultrasound is preferred imaging modalities for the diagnosis and the monitoring of pregnant women and their unborn babies, right? Because this is non-invasive and easy to use and very safe. And ultrasound provides real-time imaging, right? So make a very good tool for guiding minimum invasive procedures, such as needle biopsies and fluid aspiration. Okay, so all these are the benefits of using ultrasound imaging. So the risk of ultrasound image I would consider very minimal, right? So this diagnosed ultrasound is generally regarded as safe and does not produce ionizing radiation like that produced by X-rays or CTs. And ultrasound energy has the potential to produce biological effects on the body. So this maybe have some minor effects on the body. And ultrasound may heat up the tissue slightly, right? Because you do have the sound wave, the energy, right? Close to the tissue. Maybe there can be heat up slightly, but overall, this is has maybe minimal risk of using the ultrasound imaging. Okay. So here are some of the reference. If you're interested into know more about some of the fundamentals of these X-ray, CT, or ultrasound, you can go through these kind of reference. Okay. Okay, so I think that's all for today. So I'm gonna end here. So for the next lecture, we'll talk about MRI and the nuclear medicine, like PET. Okay.